Can I be anovulatory even with regular periods? Imagine going through your monthly cycle, feeling like everything is normal, but still wondering if you're actually ovulating. It might surprise you, but yes, you can have regular periods and still not ovulate. This is a common question among women trying to conceive. Having a regular period does not always mean that ovulation has happened. So, what exactly is anovulation? It means your ovaries don't release an egg during your cycle. Without that egg releases, pregnancy can't happen that month. Anovulation is responsible for about 30% of infertility cases in women. That's a big chunk, showing how common this issue really is. Now, you might think that if your periods come regularly, everything is fine. But here's the tricky part. Sometimes, bleeding occurs without ovulation. This is called anovulatory bleeding or abnormal uterine bleeding. It happens because of hormonal fluctuations that aren't related to the normal ovulation process. The bleeding can look just like a regular period, but it's not. It might be lighter or heavier than usual and happen irregularly. Understanding how ovulation normally works helps explain why this can happen. Your brain, ovaries, and hormones work together in a complex dance. The hypothalamus releases a hormone that signals your pituitary gland to send other hormones. These hormones tell your ovaries to develop follicles, produce estrogen, and then trigger a surge of luteinizing hormone. That surge causes the egg to be released. If any part of this process is disrupted, ovulation might not happen, even if your body still sheds the uterine lining. So, how can you tell if you're not ovulating despite regular periods? One sign is your basal body temperature. Normally, your temperature rises slightly after ovulation. If it doesn't, ovulation might not have occurred. You can also watch your cervical mucus. During ovulation, it becomes clear, stretchy, and egg white-like. If it doesn't change, that's another sign. You might also notice that premenstrual symptoms like mood swings, breast tenderness, or bloating are missing or less intense. These symptoms are caused by hormones released after ovulation. If they're absent, it could mean no ovulation is happening. Lastly, if your periods are very different from your usual pattern, either very light or very heavy, that could also be a sign of anovulatory bleeding. To confirm what's really going on, a healthcare provider can do blood tests. They'll check your hormone levels, especially progesterone, luteinizing hormone, and follicle-stimulating hormone. In a normal ovulatory cycle, progesterone rises during the second half of your cycle. If it stays low, that suggests no ovulation. They might also do an ultrasound to see if follicles are developing and releasing eggs. Sometimes, other tests like thyroid function or blood sugar levels are checked too. Knowing whether you are ovulating is very important when planning for pregnancy. If you have regular periods but aren't conceiving, anovulation could be the reason. The good news is that many cases can be treated with lifestyle changes or medications to help restore ovulation. To prepare for pregnancy, it's helpful to track more than just your period dates. Use a basal body thermometer, observe your cervical mucus, and note any premenstrual symptoms. If you notice irregularities, or if you've been trying to conceive for several months without success, talk to your healthcare provider. They can help determine if anovulation is affecting your fertility and guide you toward the right treatment options.